Good morning, and here to discuss a question that we have. Many of our patients that come in have been pregnant, had children, and prior to that have had implants. And one question that arose is what happens to implants after pregnancy? Well, nothing. Pregnancy isn't going to change implants. It could potentially change the overlying breast. It could potentially change the position of the implant, but the implant is going to be pretty sound in the sense nothing's going to happen to the implant. Now, oftentimes after pregnancy, the breasts obviously change. During pregnancy, the breast will engorge, get larger, produce milk. After pregnancy, then these changes will reverse, but sometimes keep going and leave you with changes that are undesirable. Hanging breasts, deflated breasts, loss of volume, stretch marks, you name it, even a position of the nipple which is lower than we want it to be. So after pregnancy, the implants are going to be the same, right? They're going to be still intact. It's just what happens to the overlying breast tissue. Now, what do we do to address that? It truly depends on the exam, where the nipple is, what volume you have. Sometimes it's a matter of doing a breast lift around the implant. Depending on how old the implants are, we might exchange them at the time, which is very typical because you go to surgery, you're there, refresh the implants, so you kind of start at a baseline again. So we could do a lift to the breast, sometimes maybe a larger implant to replace some of that volume you lost. But two most common things in the practice, and also that might be associated with a mommy makeover because changes happen to the abdomen as well. But that's it for now. So pregnancy does not affect the implants, but it does affect the overlying breast tissue and skin.